Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. We're going to talk about colonoscopy. Most Americans are led to believe that after a certain age, you have to succumb to being drugged and having a spotlight put up your rectum so somebody can root around in there and look around. If you have polyps, which I've read 1 out of 3 Americans has polyps, they will snip those off. We need to talk about this a little bit. Let me start off with a story. This is a man, patient of mine, 55 years old, came in to see me. He said, "Hey, doc, I missed my appointment a couple weeks ago because I was in the hospital." "Really? What happened?" "I went and had my colonoscopy. First one. I'd been putting it off." He said, "That night, you wouldn't believe the blood." He said, "It would not stop bleeding. So I had to go into the emergency room. They admitted me. Ugh, it was horrible, but I'm much better now. I wonder what's going to happen next time," he said. And I'm like, whoa, 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 whoa. You're going to do that again? He goes, "Oh yeah, my doctor said I got to do it every few years?" I'm like, okay, wait. "Do you have a history of colon cancer in your family?" He said, "No." I said, "Have you ever been diagnosed with colon cancer?" He said, "No." I said, "Why are you going to succumb to that again?" There are alternatives that we don't hear about. And in Europe, the EU guidelines have adopted that they have phased out colonoscopy on a grand scale and now recommend tests that be done at home, you and your toilet, and that's all it involves. So from my research, I have discovered there are 2 tests. One is the FIT test. It stands for fecal immunochemical test, FIT, and the other one is the Cologuard test. Now they check 2 different things, so that's why it's important to do both. The FIT looks for blood in your stool, and the Cologuard looks for DNA markers associated with cancer. But you might say, "Hey, I've gotten a colonoscopy and they said I had precancerous polyps, which they cut off." What does precancerous really mean? Does it mean it's cancer? Does it mean it's abnormal in the cell growth? It's a polyp. Let's talk about polyps. You've heard of also people having polyps in their nose, right? And maybe they had those snipped off in sinus surgery. And you've probably heard me say, the one thing that happens after you have sinus surgery, one thing you should expect is another sinus surgery. Polyps, whether they're in your colon or your sinuses, is this. The tissues in your sinuses and your colon is very similar. Now, your body can create some very, very unique tissues, but it repeats itself with these 2 tissues because both your colon and your sinuses have to create secretions, and the tissue is very, very thin. It's tissue thin. Imagine a tissue you blow your nose with. It's very thin, very delicate. So when it gets abused, for instance, if you have chronic inflammation of your sinuses, chronic allergies, which so many people have problems also with air pollutants and their sinuses. There's chronic irritation. With our diets, there is chronic irritation to our colon. Believe it or not, even if everything works perfectly on you, our diets do not support the human body as it was intended to be supported. So this very delicate tissue starts to create a little pocket, a little buckle in that very thin tissue, because the underlying supportive tissues that feed it and that keep it healthy are not as healthy as they should be. So it starts to pocket out. The more it gets irritated, the more it wants to pocket outward, 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 until it's a larger and larger polyp. Think about this delicate tissue. And your body's trying to repair it, but still it gets assaulted over and over again by our environment and our food and pollution and inflammation. And then somebody comes along and snips it and creates then a wound on this outpocketing of this very delicate tissue. What do you think your body does? It needs to heal the wound. So it does it with inflammation. And what do you think happens then? Another polyp forms. I know this is ludicrous thinking that removing a polyp could create the possibility of another polyp. But our body's just trying to make do. So what I do for colon health and for colon screening is I do the FIT test and the Cologuard test every year. And I got to tell you something else too. You know, the colonoscopy test gets a lot of media attention because there are some celebrities that have gotten the test, and you know, they found they had actual cancer and their life was saved, and they go on to be spokespeople. And I support them in their healing. But actually, there is no research that indicates a colonoscopy done at the routine it's done prevents cancers. Now, as soon as the colonoscopy test started to be getting done, this was 25 years ago or 20 years ago, the colon cancer rates started to decline. Polyps did not start to get removed until after the colonoscopy test started. And still the colon cancer rates are declining, which is great. And it may possibly have something to do with the lack of false or the lessening of false foods in our diet, like trans fats and things like that. But the tests, the research study that supports whether colonoscopies reduce the death rate from colon cancer is not yet published. There is currently a 25-year research test in progress. Now, if you're wanting more information on this, I invite you to get Dr. Gilbert Welch's book, Overdiagnosed. He dedicates a significant portion of this book talking about colonoscopy and colon cancer. I also invite you to buy this book to support Dr. Gilbert Welch, because like many whistleblowers, very recently, he was removed from his position that he had held for years. His reputation was tarnished, and I believe it's because he put himself out there telling the truth. He also has his book on an Audible book, which is very entertaining. He reads it so with such humor for such a maybe what could be a stale subject. But please support Dr. Gilbert Welch. Do your own research. And when your health practitioner says, well, it's time for that barbaric thing where we make you unconscious and you won't remember it, and I don't know what's more scary, getting it done or not remembering it. Or waking up in the middle of it. I've heard of that too. And say, wait a minute, I have this alternative. I have been doing this test on my own, this FIT test. And if you could write me a prescription for the Cologuard, I will add that. And could I make a deal with you that if I do this routinely going forward and share my results with you, could we put off or eliminate having a colonoscopy done? I've done my research. I know my family history. I watch my diet. I believe I'm my own best expert. And if your healthcare practitioner supports you in that, excellent. If they do not, I invite you to find a different healthcare practitioner. Now, there is another video that you can watch on my channel where I talk about a food that you can eat that helps to repair that very thin lining of the intestinal wall and may also help your sinuses also to repair that very thin lining. It is my video on bone broth. Yes, believe it or not, eating bone broth feeds the lining, this very delicate tissue, and you must leave those fats in the bone broth. Don't skim them off because it's those fats that create healthy cells in our body. Our body must have good fats to build good, healthy cell walls. And these very thin linings, that's all they really are. So, as always, putting the power and knowledge of your health back in your hands. Bye for now.